So for this episode of OMTV, we're going to discuss specifically one of the modalities. It's going to be muscle energy. So what that is, it's a mode of treatment where you're using the active participation of the patient. You're using their muscular contraction in order to cause a whole lot of effects, essentially. The way it's going to work is I'm going to break down the physiology a little bit, and then Jamie's going to take care of how to actually make this into a treatment, because there's like a gap between theory and application, and well, it's worthwhile to traverse said gap. So, onto the physiology. What happens is muscle ends up moving, muscle moves bone, right? That whole story. And what happens is the muscle at the ends of it have tendons. These tendons plug into the bones, and when the muscle contracts, it pulls at these tendons, and then it makes the joints move. Now, embedded into the tendons are these things called Golgi tendon. They're actually nerves, which is confusing because I said Golgi tendon, but the Golgi tendon is a nerve, so deal with it. And its job is, essentially, it's a dynamometer. And we're done. Or not. Okay, so dynamometer is essentially, it's a force transduction type of tool. What happens is, the Golgi tendon is a nerve designed to pick up on how much force the muscle is actually exerting on a set joint. So the harder you contract, the more the Golgi tendon fires, and that lets the brain know what exactly is going on. So it lets you know how much, it's your way of sensing exertion, essentially. Now, the things that the Golgi tendon does with this reflex is, it ends up piloting reflexes that makes one muscle activate over the other, and ends up causing protective reflexes. And in the long run, the protective reflexes is what we're concerned with as manual therapists, as osteopaths. What happens is, if a muscle undergoes a significant load under a very short time, the Golgi tendon picks up on that rapid force transmission and tells the muscle to stop. Because what happens is, if the muscle can't handle the load, or if the tendon's not ready to take that load, and that load happens, things start to break, and breaking muscle is bad because muscles don't heal, they scar, and scarring is bad because scars are bad. So what happens is, right?
I like it.
So what happens is, as the force increases, the Golgi tendon eventually goes, this force is too much, we need this to stop, and it forces you, regardless of your thought process, to actually relax. So everything about that time when, at some point, you've probably lifted something that's way too heavy for yourself, and you realize your entire body just can't handle it, and it's not like you tried really hard and then you couldn't do it. It's like you lifted really hard and then your body went nope. And then you just stopped because your body went nope. This is the neural mechanism behind that nope. Okay? So what happens is, as osteopaths, during muscle energy, we exploit the nope reflex, which is actually called the Golgi tendon reflex, not the nope reflex. Please don't say this for a board exam. In order to get a therapeutic benefit, which Jamie's going to talk about now. Jamie, go.
Right. So within muscle energy, there are different types of muscle energy that are based off of everything that Dante just talked about. So the first one, and the most common one that we use, is called the post-isometric relaxation. And in post-isometric relaxation, basically what you're doing is, it's a direct technique form of muscle energy where you're bringing the patient to their physiologic barrier. So say my wrist liked to be flexed, right? I would therefore bring my wrist into extension as far as it could go, right? And then I would actively have them push against me. Remember, this is an active patient force while you're holding them at their barrier for 3 to 5 seconds, right? And this causes activation of the tense muscles, okay? By activating those tense muscles, right, and then allowing them to relax, you have this refractory period, which Dante sort of talked about. And during that refractory period, you can further take that person into their barrier and stretch out that muscle, taking advantage of that time period where the nope reflex is just saying, nope, not going to move anymore, right? So you stretch it out.
Just to clarify, that nope reflex is the muscles go limp. That is
right.
The actual manifestation. The Golgi tendon tells the muscles to stop contracting, period.
Right.
Which is nope.
Which is a nope. So essentially, that's what your post-isometric relaxation is, because during that, after that isometric contraction, remember isometric meaning equal and opposing forces, right? So after that time period, your muscle relaxes and you can stretch them further, okay? The next type is called respiratory assist muscle energy. And respiratory assist muscle energy is basically just utilizing your respiratory mechanism and to relax the bony structures around it. So this is especially applied to like the ribs and the sacrum. So for example, when you breathe in, your respiratory muscles are pulling your ribs upwards. You can use that to your advantage if your ribs are stuck down, for example, and you can help, nope, that's not what it is. You want to use them for, say,
That's the next one.
You want to use them for an inhalation dysfunction, we'll say, where your where your ribs are actually stuck up, right? So then when you breathe out, and the muscles, your respiratory muscles are pulling them down, you can actually forcefully push the rib downwards. There's joint mobilization. So joint mobilization is basically, say I have some sort of lever, right, and I have a rope tied to the end of it. If I pull on that rope, which in this case would be the muscle, by activating it, I'm going to actually pull it downwards like this. I'm physically moving whatever lever or bone in this scenario that is attached to that muscle by activating that muscle. So that's joint mobilization. There's another term which we don't use as much, oculocephalogyric.
Magic.
Magic. Where basically, and this has to do with your eyes. So when you look up voluntarily, in order to help you continue to look upwards, the muscles in the front of your neck will relax, and that frees up your head to look up. Same thing with looking down, right? The muscles on the back of your neck are going to relax. So that's the oculocephalogyric reflex. There's your crossed extensor reflex, which basically tells us, so when one muscle is contracting and activating, right, the muscle on the opposite side, that same muscle is also going to relax. So say if I contracted my biceps on this side, right, my biceps on this side are going to relax. And Dante and I were talking about it before, and, he made a reference to how when we used to be, walking on all fours, during the evolutionary process, it benefits us to have, when we bring up one leg, the other quad can't contract, for example, because otherwise we'd be like this. But if you bring up one leg and the other relaxes, then that allows us to walk. And that applies even now as we're walking, just not on all fours. And then the last one is the reciprocal inhibition, and that one you'll see with things like innominate muscle energy. So in that previous series we talked about anterior and posterior innominates. So in an anterior innominate you have tight quads, for example, right? And the treatment involves activating the hamstrings. And basically what that's what the reflex is that when you activate the antagonist muscle, the agonist muscle, which in this case is the quads, has to relax, and that allows us to help use joint mobilization as well to rotate the hips backwards, right? So if going from an anterior innominate back to a posterior, more neutral position, because the hamstrings are also attached posteriorly on the innominates. So by contracting them and having the quads relax, we're able to bring them back to neutral. Okay, so that seems to be a brief overview of what muscle energy is. Stay tuned for the other modalities to come.
Go lift.